Next, we're going to go over your EZ-IO drill. This is going to be in your little Go Pack here that's got your lift sheet and your glucose meter and this drill in it as well. They did order the needles for it, but they're not in as of yet. There's 3 different size needles that you're going to run into. The pink is for pediatrics. It's like very small if you look at that. The blue one is for your average adult. That one, the needle is a little bit larger. And then we've got the yellow, which is your bariatric needle, which is much larger. So it depends on where you're going as far as which needle you're going to use, and it's also going to depend on like how much fat tissue the person has. The easiest spot, if you've never done these before, is to drill into the tibia. So this is somebody that's like actively coating. Like your surgical patient should have IV access for the most part. This would be somebody that like walks in and collapses, or like at the cancer center, I know before they had where like an overdose got dumped on their front door. So something along those lines happens. That you need quick IV or quick access and they don't have a pulse. I highly recommend this. This takes like 10 seconds to get done, where otherwise you're like fumbling around trying to find a vein in somebody that doesn't have any blood pressure. It's hard. So what you're gonna do then is you're gonna figure out which size needle you need. The spot that you're gonna be drilling, if you find where your kneecap is, you wanna go 2 finger breadths below that and just a little bit to the inside. There's a very flat spot on your tibia there. This is like your tibial bone. You can see that right here, that this is flat. So you go 2 finger breadths below and to the inside here. That's a really great spot to drill because of the fact that it's going to be able to stabilize the needle well, and it's also very easily to identify. So what you're going to do then is you're going to find that spot. You're going to take the little ChloraPrep swab that comes in the kits. You're going to wipe this whole thing off, make sure that it's clean. These needles then are magnetic, so they just like latch on to the drill like that. They just pop back off. So this is just a magnetic thing. You're going to squeeze the needle, pop the cap off. And then if you look, it's probably gonna be kind of hard to see on the phone, but there's these little lines on the needles. When you go to actually stick this in, actually the lines on this one is a little bit easier to see. There's 4 lines on this one. So what you're gonna wanna do then is, when you find your spot, you're gonna take the needle and you're just gonna push it through the tissue without drilling at all. And you're gonna push until you feel the resistance of the bone. Once you hit that resistance of the bone, you have to make sure that there's at least one of those black lines still showing. That lets you know that you've got enough needle depth left to be able to actually get into the middle of the bone where the marrow is, and that's where you're actually looking to get to be able to do your medications and your infusions and so forth. So you push it down until you feel resistance. You make sure that one black line is there, and then all you do is you pull the trigger and put a little bit of pressure on it, and it's going to go all again very easily by itself. When you feel the give, and once it hits that marrow complex on the inside of the bone, there's a definite give to it that you can feel. At that point, you stop drilling. You don't want to keep going because it's going to widen out the hole and make it leak. You're going to pinch the base of this EZ-IO needle. The top part then screws off, and the big portion of the needle then comes out. So this comes out then. You're going to put this on your needle safety guard here. You'll just stick this in here from that aspect. Now, you guys aren't doing labs, so you wouldn't have to do this, but this is where you would end up like pulling blood to be able to draw your labs or so forth. If you don't see blood coming out of this, or you had a syringe hooked up and pull back and you don't get anything, don't worry. That doesn't mean that you're in the wrong spot. Sometimes the marrow will actually kind of plug up the needle at first. So then you're gonna take your little extension set that's also in this needle kit here. And you're going to first put this brace on. So this is your stabilization device. This is gonna go over the top of it like this. And then you will have like, you're gonna have a saline syringe hooked to it. You're gonna have it pre-filled here, and from there, after that this is taped down, you're gonna hook this up on the top of it. And then what you need to do is you need to fast flush this with 20 cc's of saline to open up that marrow complex and make it so that it can flow a little bit easier. From there, if you're giving fluid boluses, I recommend that you put it on a pressure bag. There is a little bit of resistance in the tibia as far as that's concerned. Otherwise, your medications, any medication you can give IV, you can give it through this. You're fine doing it that way. Contraindications for doing this: if they've had like a total knee, obviously you're not going to be able to use that tibia spot. Try the other leg. If you tried drilling before in the leg, like say down at the ankle, or like if you tried the tibia, you can't use the ankle spot because the bone's already got a hole in it, so you wouldn't do it that way. Or if they've got cellulitis, you're not going to want to use that leg either. The other prominent spot that we do use for these is the humeral head up here. This one's a little bit harder to figure out where it is. Can I borrow you for a second? So what you end up doing is you take one hand and you put it in their armpit, and the other one you go midway on the middle of their arm here. Run both of your thumbs up, and what you're gonna do is you're gonna feel the humeral head. It kind of feels like a golf ball on a tee. So when you feel that, you go 2 finger breadths above that. That's where you're gonna drill. And when you drill at you aim for the scapula on the opposite side of their body. So you're going to be drilling at a downward angle this way. Anytime you're doing this one, you're going to want to use this bariatric needle because they want to get it deeper into the humeral head, because you're drilling into this. You got a lot of room to be able to make it. But they always want you to use the bariatric needle when you do this. Benefit of doing this one, like I said, it's a little bit harder to find, but this one is much more vascular. So fluids go in a lot quicker. You usually don't need the pressure bag like you do for like when you're doing the tibia. And also the medications get to the heart a lot quicker. So like you can actually do like adenosine through this, which normally you wouldn't be able to do that through a tibia or even like a peripheral IV in the forearm. So it's
Right side?
what's that?
Right side?
Either one. You can use either one. So that's how that goes in. Same thing for contraindications as far as the cellulitis and so forth, that you wouldn't want to use it from that aspect, or if they have a bone fracture. But that's about it as far as that's concerned. Taking them out, you shouldn't have to worry about this. I'm assuming that they're going to leave it in for EMS when they get there. But if you have to, you take off the extension set here, you take off the stabilization device, you take a 10 cc syringe, hook it up to the end of this, and then you just keep turning clockwise as you pull, and they pull up pretty easily. So if you use the humeral head one, and you happen to get ROSC, like the person wakes up again, you need to stabilize their arm. You need to keep their arm down. Problem is with where you put that, it can actually hit the clavicular head here. We had it like initially when we started doing this in the ED, that somebody like brought their arm up and it literally bent the needle to a 90-degree angle. The risk of it is that if that needle breaks off, you're gonna have to go in and try and surgically remove it later. So make sure that you stabilize the arm. If you decide that you're gonna use that humeral one instead. I don't think you guys are ever going to do this either, but if you do it on an awake patient, we do that in kid care all the time. Like you get these kids that come in that have had vomiting, diarrhea for 5-6 days and are super dehydrated. If you do that, you're going to want to put some lidocaine in first. So it's the same lidocaine that you use like from your crash cart. I'd have to look at the dosage. I think it's 0.5 mg per kg, if I remember correctly. But what you're going to do then is before you do the saline flush, that rapid flush, once you get the drill in, it doesn't really hurt going through the bone. That part they don't feel, but when you do that rapid 20 cc flush, that hurts like the dickens as far as that's concerned. They start screaming otherwise. So what you do is you very slowly do this lidocaine injection into their limb. You let it sit for about 2 minutes. You do a trial saline push just to see if they react or not. If they do, you do a second lidocaine bolus, and then you like let it sit for another 2 minutes. And then from that point, you should be able to flush it and do your medications like normal. So. These things can stand for up to 24 hours, so by then you should be able to get like regular IV access anyway, so you should be done.
But you can move to another site if you need to?
Yeah, yeah. So, any questions on that at all? I think I hit all the highlights on that, so, all right, we're good.
Awesome, thank you.
Yep.